To review my orders from for a intermittent bolus feeding. I'm going to knock on the door. I'm going to have my supplies with me, and it's going to be my syringe, gloves, my formula, and my 30 mLs of water. And my formula, I'm going to already have looked at the expiration date on the can. Knock on the door. Going to introduce myself, wash my hands, check the patient for identification, which will be his name and date of birth. Pull the curtain for privacy. Now I'm going to start the procedure. I'm going to put on my gloves. I'm going to take my tubing and check for residual. Okay. I'm going to flush with 30 mLs of water. Now I'm going to administer formula. Okay. I'm going to remove my tubing. Check to see how well the patient tolerated it. I'm going to take my gloves off. I'm going to put the patient in a comfortable position, call light within reach, ask the patient if they need anything else, clean up my mess, and go and document. Okay, I'm going to be reviewing the doctor's orders for applying a TED hose today. I'm going to look to see if they are ordered for knee high or thigh high, and they are ordered for knee high. So I'm going to gather my supplies, or my TED hose, and my baby powder, and I'm going to knock on the door. Come in. Hello, my name is Ashley Torres. I'm going to be your student nurse today, and I'm going to be applying your TED hose. Okay. Can I get your name and date of birth?
Sable Paredes, 7/13/87.
All right, great. I'm going to pull the curtain for privacy, and I'm going to wash my hands. Okay. Going to assess your skin, put the powder on. Now I'm going to apply the TED hose. These are a little bit tough. Does that feel okay?
Mm-hmm.
Okay, do they feel okay, Miss Paredes?
Yes, they feel fine.
Okay. Now I'm going to wash my hands and I'm going to document how well she tolerated it. And alright, now I'm going to lower the bed and ask her if she needs anything, give her call light.
No, I'm fine.
Alright, thank you very much. For inserting a nasogastric tube, looking over, I've got my supplies or my gloves, the size of the tube and the tubing, the 50 milliliter syringe, my litmus paper, and my tape. Now I'm going to come in, knock on the door.
Come in.
Hello, my name is Ashley and I'm going to be your student nurse today, and I'm going to be administering a NG tube. Can I have your name and date of birth, please?
Sarah Berger, August 24th, 1992.
Okay, I'm going to pull the curtain for privacy. Wash my hands. Okay. First, I'm going to measure the tube. So I'm going to do it from the tip of the nose to the earlobe, and then from the earlobe to the xiphoid process. I'm going to tape it. Okay. Now I'm going to put my gloves on. Okay, while I'm doing that, I'm going to have my tubing and some lubricant so that it's easier to go down the nasal area. Now I'm going to have the patient, I'm going to raise the bed. I'm going to have the patient sit up. I'm going to have the patient hyperextend her neck. From there I'm going to insert the tube. When you start inserting the tube, once they start gagging, you have them flex their head forward, take some sips of water. As it goes down, you have them swallow, swallow, swallow. There. And you're going to tape it to their nose. Tape it down. Okay. Now I'm going to suction it to see if there's any residual and to see if placement. And I will also call the x-ray tech to come and check for placement. Now I'm going to be suctioning it out with my 50 milliliter syringe just to check for residual. Okay. And do I plug it back in or do I put in the...
You need to check the pH.
Then I gotta check the pH. Then I will put the continents into a specimen cup and get my litmus paper. Check the pH. The pH should be between 1 and 4. Now that I've done all that, I will clean up my mess and make sure the patient is in a comfortable position as what she can be. Lower the bed, give her her call light, ask her if she needs anything, and clean up my mess and wash my hands. In order to remove a nasogastric tube, gather my supplies, which is a towel or a washcloth, my gloves, and my syringe. I'm going to knock on the door.
Come in.
I'm going to introduce myself. My name is Ashley. I'm going to be your student nurse. Can I have your name and date of birth, please?
Sarah Berger, August 24th, 1992.
Great. I'm going to provide privacy. I'm going to wash my hands, and as I'm washing my hands, I'm going to describe the procedure. I'm going to be taking out this NG tube today.
Ooh, yeah.
Okay, I'm going to set up. Put my gloves on. Okay, I'm going to set this up. And I'm also going to have a towel, an extra towel just for the, that's already damp, so that the patient can wash his or her mouth and everything like that. Okay, I'm going to sit the patient up, raise the patient up. So before you take out the NG tube, you have to check for residual to make sure that everything is clear. So I'm going to unhook this. Alright, everything is fine. Clamp it. Okay, now I'm going to ask the patient, I'm going to remove the tape, and I'm going to ask the patient to take a deep breath as I coil it up, and I'm going to remove it. 1, 2, 3, deep breath. Alright. Then I'm going to quickly discard that. Ask the patient if she'd like to brush her teeth and give her her glass of water so that she can spit out, wash her mouth with her washcloth that she has there. Okay. And I'm going to discard my gloves, and I'm going to document how well the patient tolerated it. And then I'm going to lower the bed for the patient, ask her if she needs anything. Here's her call light. Can I get you anything else?
Nuh-uh.
All right.